Hi, my name is Christine Kachupi, and I'm here to inform you about Alzheimer's disease. How would you feel if you knew that someday you would have no memory of anything that happened in your life? This happens to people with Alzheimer's disease. The person affected loses all short-term and long-term memory. Alzheimer's disease is actually a very common disease. Did you know that Alzheimer's disease affects approximately 5 million people in the U.S. and 30 million people worldwide? Alzheimer's disease is becoming an increasingly popular disease among middle-aged people throughout the world. However, many people don't know what Alzheimer's disease is. Whether you know about the disease or not, it is important to inform yourself about it. To fully understand Alzheimer's disease, you need to know what it is, who it affects, how it affects the person, and what kind of treatment is being used to slow down the progression of the disease. First, I would like to explain what Alzheimer's disease is. Alzheimer's is a disease that eventually distorts and destroys all memory of a person. Alzheimer's is the most common form of dementia and has no current cure. Alzheimer's affects every individual differently. The reason for this is because there are so many different strains of Alzheimer's. Because the disease affects everyone differently, it is hard to find a cure. It is also important to understand that it is a progressive disease. This means that the person will never recover fully from the disease. You might be asking yourselves, how does it affect the person? We know that it affects everyone differently, but everyone with the disease experiences the same types of symptoms. Eventually, the brain cells in the person stop working, causing the individual to lose their memory capabilities. Scientists believe that plaque builds up in the brain, which is the main reason for the loss of communication and memory. These deposits of protein are called beta amyloid. Scientists are still not sure how the plaque contributes to Alzheimer's disease, but they believe that the plaque blocks all communication to the brain. The second most important thing you need to know about Alzheimer's disease is who it affects. According to Alzheimer's Association, 5 million people in the U.S. alone are affected by this disease. People who are in their 60s are more likely to get the disease. In fact, the older you get, the more of a risk you have to get Alzheimer's. If someone in your family has the disease, you are at a greater risk than someone who doesn't have a family member with it. The disease affects more women than men, and the disease affects all races. The third most important thing you need to know about Alzheimer's disease is how it affects the person with the disease. According to Alzheimer's Association, there are 5 stages of the disease. The first stage of the disease is the no apparent stage. During this stage, the individual does not feel any different and probably is unaware that they have Alzheimer's disease. The second stage of the disease is a very mild decline stage. During this stage, your memory starts to fail. For example, you can be confused about where you are. The third stage of Alzheimer's disease is the mild cognitive decline stage. During this stage, Alzheimer's is usually detected and diagnosed. The fourth stage of Alzheimer's is the early stage of Alzheimer's. During this stage, the individual can't perform normal tasks that they used to be able to do. For example, driving. The fifth stage of Alzheimer's is the moderate stage of this disease. During this stage, the person becomes confused as to where they are or where they live. They are still able to eat by themselves and go to the bathroom and things of that nature. The sixth stage of Alzheimer's is the moderately severe stage of Alzheimer's disease. During this stage, the person has trouble recalling family members' names. They are no longer independent people. The final stage of Alzheimer's disease is a very severe stage. During this stage, they have trouble with daily activities such as using the bathroom and taking a shower. Their swallowing becomes impaired. They lose all communication skills and have no memory left. Eventually, they lose all control over their muscles. The fourth most important thing you need to know about the disease is a treatment that is being used to slow down the progression of Alzheimer's. Aricept is one of the most popular drugs used among Alzheimer's patients. This medication helps to maintain the ability to perform daily activities. The bad thing about this drug is that once you are in the later stages of Alzheimer's, the medication is no longer effective. Another treatment that is being used is combination therapy, which is the combination using 2 or more drugs at the same time to have more an effect on the individual. There is currently no cure for Alzheimer's disease. Scientists believe that if you play more memory games, such as crossword puzzles, throughout your life, you will decrease the chance of getting the disease. This is recommended for middle-aged people to do as well. Alzheimer's disease is becoming an increasingly popular disease throughout the world. It is important to know about the disease and who is at risk of getting the disease, as well as who it affects and what the treatments are used to slow down the progression of the disease. Many people know someone who is affected by this devastating disease that deprives a person of their identity. If people become more informed of the disease, there will hopefully be a cure to prevent someone from being at risk of getting the disease. Please don't forget the forgetting. If the cure is not found soon, this disease will devastate more lives of innocent people.